Welcome to Take Me to Hoag, the podcast where we explore the future of healthcare with Hoag thought leaders. I'm Robert Brunswick, and today I'm joined by Dr. Allyson Brooks, Executive Medical Director of Hoag's Women's Health Institute. Over her 30-year career at Hoag, Dr. Brooks has helped shape the Institute into a source of comprehensive care designed to meet women at every stage. And today she will tell us about her intimate perspective of the Institute. Welcome, Allyson.
Thank you for having me, Robert.
Yeah, looking forward to spending time today. As mentioned, you're the Executive Medical Director of Hoag's Women's Health Institute. You've been here for over 30 years, but I think today you're going to take us on a little bit different journey and discussion. Can you share a little bit?
Yes, I think today I'm going to be sharing a little bit how I transitioned from being a leader and maybe orchestrator and designer of the Institute to personally experiencing the care and the experience of the Institute in my personal journey with breast cancer that I've been undergoing over the last 3 months.
Well, first, let me just share from, the Hoag board, the Hoag community, everybody. You have our full love and support for what you're going through. And I know this is going to be a great outcome for you. But yes, the experience you now have been building this institute and helping to build this institute, and now seeing it from the perspective of a patient, it's got to probably provide some advantages and perspective as you think about leadership going forward and the role that we provide to so many women in our community.
Yes, absolutely. Everything was moving along very nicely. We're planning our opening of our new women's pavilion in Irvine and the Sun Family Campus. We're expanding our NICU. We're designing incredible programs using the voice of women in orthopedics and heart care and a lot of different things. And all of a sudden, when I was playing with my granddaughter, I felt a lump in my breast. And, I think I did what most women do, which is a little bit of denial. That's kind of interesting. We'll get back to that at some point in the future. And about 2 weeks later, got back to that and decided, well, I think I need to do something about that because I've been a good patient. Every year I go in and get my recommended imaging and live a good, clean life and don't have a family history and wasn't expecting anything. And the minute I realized that I was potentially a patient, that objectivity is gone.
Very interesting.
Completely gone. And that's actually why they say you shouldn't take care of your family.
So you worried too.
And you know what I did? I thought, well, I don't want to falsely alarm my doctors.
Oh, boy.
Because I just had my mammogram 10 months ago, right? And so I did what every woman does. You start second-guessing yourself.
Right.
So our humanity
so
is what...
you became a patient pretty quick.
Yeah.
That self-interest was realized.
Yes, very quickly.
Yeah, interesting.
Very quickly. And then you go from a little bit of that, I'm glad I trusted myself and followed through, to, wow, why didn't I trust myself 2 weeks earlier? And it wouldn't have made a difference.
Right.
But why do we do that?
Right.
And so my point to women is trust yourself. There's no one who knows you better than you.
Yeah.
And we should be, and the system should be here to serve. Over the course of about 7 days, I went from planning for the future for Hoag to trying to plan for my future of how to stay healthy and how to have tremendous trust and faith and hope in what Hoag and the team would do for me.
So interestingly, the ironies here, cancer does not discriminate.
Right.
Here you are realizing this moment. And so maybe a little more color on the path of your diagnosis would be helpful for our listenership, if you don't mind.
Yes. So I did what we always advise people to do. I called my doctor, my gynecologist, and I said, I feel something. Probably need to move up my imaging. Can you arrange that? And because we have a no sleepless nights program here at Hoag where we don't want women to worry about what they think they might have, and we want to reassure them as soon as possible. They got me in within 24 hours into our breast center, did some imaging and said, this is concerning. We need to do a biopsy. And as they typically do, not just because I work at Hoag or I've been at Hoag for 30 years, but that's how we do it here, is they said, we're going to move forward with advanced imaging and biopsies to try to get to a diagnosis and get you to treatment as soon as possible. So basically, from the time of my imaging on a Friday to 10 days later on a Monday, when I was in a chemotherapy chair in the Infusion Center, starting my 5-month journey of neoadjuvant chemotherapy for what's called a triple-negative breast cancer. But the specifics of the cancer really are not what to me is most important. It's many women have cancer. Many women have many chronic conditions. It's that we can do hard things, and how do we approach it? And what I would say was most enlightening for me is that even though I'm a scientist, even though I'm an OBGYN, even though I have a curious mind and used to investigate things to the nth degree on behalf of my patients and on behalf of the profession, I initially chose this approach that I called the Clydesdale approach, which was put my blinders on, look down, plod forward, and trust. And that really, looking back, that was my coping mechanism.
Mm-hmm.
It was unusual for me, but it was very comfortable for me because I had been at Hoag for 30 years and I had helped design the teams, and I know who the people are that work here, and I know what drives them, and I know that they combine that, what we all expect, the science of caring for me and for my condition, but also that I would get the experience that I needed to heal and to make the journey. So the Clydesdale approach, worked for about 10 weeks. And then I decided that's not working that well. I need to, open up my horizons a little bit more.
Sure.
So I called it the peaky blinders. Just like, let me look outside a little bit and see what's happening. And maybe if I need to advocate for myself, if I need to, put some agency into the process rather than just the blind trust and faith that I had in my care team and in Hoag that they were going to move mountains to do what needed to be done. And so I started looking up and around a little bit, not too much, wanted to be comfortable and kind of get back into the Clydesdale approach. But I also sort of personalized my journey in saying that initially I was submitting to it. And then I decided I'm going to surrender to it. And the surrender feels different. I don't have to shoulder it all myself. I can share it. I can break it apart into smaller aspects that, I can compartmentalize the journey and make it a little bit more palatable. So that surrender has been really, really helpful and there was one particular aspect that I wanted to share with you because I knew you would appreciate it.
Sure.
And that is all high-performing people, whether they're athletes, mothers, international women, executives, or institute builders, they have kind of a little bit of distance around them that they maintain, professional distance, personal distance, and that wasn't really working either, right? Because I was shouldering it all. Even though I had said I was surrendering, I was shouldering it all. And I was not really comfortable with letting people in. So when they said, can I come sit with you in the infusion center? I was like, oh no, I got this. I'm just gonna bring my laptop, do my emails, send off my directives. I got this. When they said, can I bring you dinner? No, my husband cooks. It's all great. Can I walk your dog? Oh no, I love walking my dog. It just perpetuated, right? And finally, a new mutual friend gave the advice of, it's okay to let people in. Let them in. This isn't the book that Mel Robbins wrote called Let Them.
Right.
This is Allyson's book called Let Them In. And it's a win-win because they want in, because they want to be there for you. And it's not a burden for them to be there for you. And you need them too. So that has been an amazing
Transformation.
journey. Yeah.
Yeah. Well, appreciate your candor. Not surprising that you would put the blinders on and charge ahead. I think that's just a nature of your success. But also now you've learned another way to adapt to another life experience that will ultimately help you. And I think the vulnerability that you're providing and sharing is going to really help so many that are listening in today. So thank you for that.
As part of my journey, I actually thought it would be interesting to let people in on what the experience looks like from a patient's perspective, and invited the team to come down and see the infusion center, because I don't really want this to be a story about my cancer or my journey. It's a story about all of the things that come together to create that experience that makes it a trusting, healing environment that you want to come back to over and over again. Hi.
Welcome.
Nice to see you. Thanks for having me.
Nice to see you. Come on, let's get inside.
Okay. Patricia is our valet concierge. Make sure that no one but cancer patients park in the parking lot here. Yeah. Thank you. Stay warm out here. Okay, so we're walking into the Patty and George Hoag Cancer Center, and this is where I come for my infusions. Now on my 11th week, and it just feels like a constant presence in my life. So I try to be excited when I come and then try to get recovered before I come back. Hi.
Dr. Brooks checking in?
Yes.
Okay.
So she's gonna grab my chart, and then she'll take me back and weigh me and bring me to my room. She's always lovely. Yes. How's your day?
What are you doing?
Good. Little blustery.
Yeah.
Yeah.
I gotta take your weight.
There's a bell on the wall that I've been here once when the bell was rung, and basically it's when an individual completes their chemotherapy or their infusion cycles, and all the staff kind of stand around. They ring the bell and they give them blessings and compliment them on their strength and their bravery and their journey. That'll be mine someday.
Can I check your blood pressure?
You feel like a snack or a beverage of any kind?
I would love some black coffee.
Black coffee,
Black.
anything snack on.
No.
No cream, just black.
Yeah, thank
Right
you.
back. You're
All right,
welcome.
thank you. So that's one of our amazing volunteers, and they try to make you comfortable. Hi, Allison.
How are you doing today?
Doing well. Doing well. Happy to be
Awesome.
here.
Perfect. How did
Thank
your
you.
last treatment go?
You know, everything went really well.
Awesome. No new side effects at all from the medications?
No, just the same
Same.
things we talk about, fatigue
Yes.
and the neuropathy is stable.
Okay, good. All right, same routine as always. I'm gonna go ahead, draw some blood work from your port. After that, we'll check the blood work, make sure it meets treatment parameters, and then we can release your medications for the day.
Sounds
Okay.
good. All right, thank you.
You're welcome.
So this is usually where I am for anywhere from 3 to 5 hours. So there's full-length windows looking out on the Hoag campus and eucalyptus trees. And there's beautiful kind of vinyl wood flooring and light walls. And then you see your chemotherapy infusing in. And I hear the staff in the background. Sometimes they're a little more raucous and they're celebrating something. Maybe someone's going to ring the bell. But it can feel depressing in here too. You know, like here I'm sitting in a chair, a chemo chair, but some of the other rooms have beds, and that's where people are curled up trying to tolerate the toxicity of the chemo. So you see people at all different stages of their care.
I will go ahead and get these labs sent off, and we will go from there.
I noticed that I was always trying to help when I first came in. So that's a nice transformation, to let others take care of you and not be directive. I think they appreciate it too, It's nice to be taken care of. So I was thinking of the book I read in college about Michelangelo and, the painting of the Sistine Chapel. And it's called The Agony and the Ecstasy. I mean, everyone knows that, but it was, the agony of the process and the diagnosis and the surrender and the unknown, but also the ecstasy of being taken care of and of responding and getting better and knowing it's a healing journey and knowing that there's learnings along the way and silver linings. They don't have to be at the end. They can be all along the way.
Well, I have great news. Your lab work came back. Everything meets treatment parameters.
Great.
So I'm going to hook you up to some saline. We'll do your pre-meds as always, and then we'll go ahead and start your chemo for the day.
Okay, thank you, Allyson.
Yeah, you got it.
One of the first days that I was here, I saw a neighbor and she said, "Oh, are you giving a tour?" I was like, no, I'm being treated for breast cancer. And she was being treated for breast cancer. So now we're walking that journey together. Your eyes get opened and your relationships get opened and your heart gets opened. So those are some silver linings. People get things all the time, and cancer is one thing that I happen to get, but there's many, many, many other things, and women can do hard things, and they have done hard things, and so we each get through them in our own way. And when I come here on my infusion days, or sometimes when I just pop in because I have a question, I feel like, oh, these are my people. And they know me, and they'll help me. Okay, I think I'll take this one. This is lovely. Thank you.
Great news. Your chemo's all done, all flushed through. I'm going to go ahead, take down the line, and then just flush your port. And that is it.
Okay, sounds good. Thanks, Allyson.
Yeah, you got it.
When I'm done, I'm eager to be unhooked. It's draining and you're tired, but it's also an accomplishment. You go, oh my gosh, I just finished my 11th, whatever. So it feels good. Thanks for my coffee.
Welcome. Have a good message.
You too. Bye. All right, see you later, ladies. See you next week. Okay, bye. I'm very early in the journey. This is
so-
not in the past. This is in the present,
Right.
and I'm not all seeing or all knowing. And what's on the horizon is still unknown. Right?
Okay.
It's how I'm responding and how the imaging results look, how I tolerate some of the side effects and the toxicities, and so it's going to take some time.
Right. I want to thank you for giving us that perspective and a glimpse of that care. I think that's very hands-on value to our viewership. So thank you for that. So infusion is chemo. Radiation comes with that too, or that's a choice? That's a supplement?
As I understand it, what the journey is for this triple negative breast cancer is neoadjuvant chemotherapy for 5 to 6 months, and then you do surgery, and you decide with your care team on whether you preserve your breasts or whether you have a mastectomy, and whether if you have a mastectomy, you have reconstruction.
Which is that oncoplast? How do you pronounce that?
Oncoplastic surgery, which is what we're known for.
Which
yes.
is Hoag's known for? Okay.
Yeah. And those decisions can be they can be personal. They can also be driven by your genetics. With the guidance of my surgeons, I will decide which type of surgery to have, or they will decide for me.
Sure.
And then depending on the results, when the pathologist looks at everything, they'll decide whether I need radiation. And then we will do another 6 to 9 months of immunotherapy to really kind of keep any loose cancer cells at bay and prevent them from setting up shop and starting the cycle over again. So these algorithms are much more challenging than one would think. I'm a doctor. I understand that there's decision trees and decision points.
Yes.
But you can't simplify them. They're very, very complex. And that's where you have to have the trust in your team. And I've learned that now, or I'm learning that they know more, that I can't learn it all on ChatGPT 5.2, that it has to be conversation. And actually, the conversation needs to be with women that have gone through it themselves.
Sure.
What would they have done differently if they had had different information available to them? And so it's a journey. And, I call it Mr. Toad's Wild Ride.
Yeah. Well, the timeline you've expressed there, if I got the math right, is over a year.
Right.
So you're really on this journey for over a year, and you've got to, as you say, there's decision trees everywhere along the way. But that sharing, I think, is valuable. You've been caring for women your whole life. Now you're on this other side, and I think as fate would have it, you're receiving care from the institution that you built. So that's got to give you some pride and some confidence. I think that it would be worthy to understand how that perspective as a patient has maybe changed your views now going forward as a doctor and as a leader of this institute.
Well, it's definitely added an exclamation point to how we designed things, meaning I feel like we have the recipe. We have some unfinished business in terms of what we want to design and deliver for women's healthcare at all stages and ages going forward. But I feel like we have the recipe. And what the recipe was and how it was conceived is that we wanted women to feel like they were getting VIP care. And that was at every step of the way. And what VIP care means is care that they want, care that has their voice infused in it, care that has them considered. They call it personalized, but where it really is about them. And they know themselves the best. They want information. They want a conversation. They want communication. And those are sometimes intangibles. We in healthcare, we promise quality, we promise safety, competence, capability, science, but that experience can be equally, if not more important, to the trust and the healing. And I think we've bantered over the years about, is this fluff? Is this necessity? Do you really need these things? Are these niceties?
Right.
And what I've learned in these 3 months is that the niceties make all the difference in the world. Everything from the familiarity of the faces to the offering of being part of a mindfulness session on Zoom, or the offering of a cup of coffee from one of our volunteers, or a 5-minute foot massage when I'm sitting in the chemo chair.
Mm-hmm.
And never would I have thought. One of my favorite movies was Pretty Woman,
Mm-hmm.
when Julia Roberts goes into, on Rodeo Drive and is kind of mistreated, and they say, you need to suck up to her. You have some service recovery to do. And in one of the experiences that I had was when they said, you're going to be getting chemo and you're going to lose your hair. It was like, I'm going to lose my what? I used to sit on my hair. That's a big part of me. And they take you into a room with 6 people and they bring 12 people to help create that Rodeo Drive experience. And they bring 750 wigs and 1,000 scarves, and they put you in front of a mirror and they help you create what you want to be when you're hairless. And that was an amazing experience. amazing experience. So all of these things that might have seemed to be fluff or niceties are just what make you feel cared for and part of the family. We're going to continue to design for VIP care going forward and use women's voices and ask them what they want, what they need, what they expect, what they're going to search for, what they're disappointed in, and implement it.
Well, I would just say, as my role on the board of directors, we hold you out in your institute and your efforts to date as really a gold standard to other institutes, and we that learning that takes place across institutes is noticed. We are renowned and known for our childbirth. I think we have more babies born in the state of California than any other hospital now. Quite congratulations on that. I think you accomplished that just at the end of last year. Is that correct?
That's right.
Yeah, amazing. But there's also preventative care. There's certain diagnoses and then treatments that are brought to bear. So a lot more than just babies. So can you help build out in our conversation a little bit about the overview, the greater overview of Hoag's Women's Health Institute for our listenership?
Yeah, so thank you for that, because I do think that when we say women's health, a lot of people think of a baby factory.
Correct.
And, we do that very, very well. There were over 9,000 women that chose to deliver at one of our 2 Hoag campuses in 2025. That's a lot of women.
Yes.
And when you take all those women and their children that went home, that's 18,000 discharges from the hospital related to childbirth. But women's health is far more than childbirth. And women, when we talk about their life stages, there's the reproductive stages, there's the midlife stages, and there's the later in life stages. And all of those need to have equal representation. And women have different needs in each of those areas. And actually, that was something that I was charged with by Ginny Uberoth when she established the Endowed Chair in Women's Health. Her mandate and her vision was that women's health wasn't just about having children or being a mother. And it was about addressing the unique stages in women's lives that need to be addressed with different approaches. And so that's the journey that we've been on in women's health. So to answer your question specifically, what is there besides having babies? Well, what about when you're in midlife and you think you're going through menopause and you're only 41, but everyone says, no, that's too early. And so right now we are actively training and educating our providers on what is perimenopause. What is midlife? Is it a decade? Is it a day? Is it a mood? What is it? What we've tried to do, and something I've been sort of leading or orchestrating, is to call it midlife, because there's some stereotypes and some negative energies and attitudes around perimenopause and menopause.
Right.
So we're trying to make it a little bit more palatable so people will be open to the discussion and have that conversation. We want to be there during all of your journeys, and midlife is a very specific journey, and it happens after you're able to have children and you're transitioning to menopause and you have new concerns about your heart health, about your bone health. And we need the providers and the services and the offerings to help them understand what's happening, to mitigate some of those effects, and to get them back on track to optimal health. And then later in life, obviously, we talk about caring for women from birth to senescence. Is how do we help them live independently and meaningfully and vitally? We talk about ageless intimacy. So we're developing programs in sexual health.
Mm-hmm.
Because you might be 85 and be severely debilitated by rheumatoid arthritis, but you're still a sexual, intimate human being, and your needs need to be addressed. So we're really trying to look at the holistic woman as she moves through her life. And I would add one more point, is that the integration of the institutes has become increasingly important and compelling. Meaning, I used to think about women's health as a silo.
Mm-hmm.
I care for women. Women have special needs. We have unique needs. I know what they are. This is how we're going to do this. But there are dependencies, and we all need to work together. So, for example, in heart health, we need to work with the Heart and Vascular Institute to optimize women's health. We need to be working with the Neurosciences Institute on cognition and memory. So there's a lot of crossover, and we want women to be able to move seamlessly through all of those areas with an integrated approach to optimizing their life and their health and their vitality.
Beautifully framed, great education. I think we're seeing that crossover, the institutes working well together, communicating well together. So I'm glad to see that so much is being activated out of your area of responsibility, the women's health. I think about my own family and the care they've received at the Health Institute. Their experience kind of gave me more depth and nuance of some of these perspectives that you've been sharing. And I think when patients, say that their experience here mattered, how do you make the difference within the Women's Health Institute? What is the it that you celebrate as a leader of your culture, of your training, of your recruiting with your team?
So that's a great question. We kind of talk about the secret sauce.
Yeah.
And, that's a little common term, but I think it's their heart and their attitude of the staff. They actually make every woman feel seen and heard and special and respected. And that's what we're trying to do. We're hiring to attitude. We're hiring to heart. And we expect competence, and we can train to capability, but we want to know that they're there to serve.
Well, I think certainly that comes across in anybody you talk to, and in my own family, I've seen that. It just feels like a home. They're being cared for as a part of the family. So obviously, you look at Women's Health Institute today. I'd have to ask you, what's unfinished? I mean, Hoag has big plans, I know, with its evolution into private care, and there must be other things on your task list as a leader that you're thinking about and opportunities for us, if you'd be willing to share those.
Yes, I think I use this term, feminism in healthcare. Women now are really expecting care that's designed with them in mind. And that has been informed by research that they have been participants in. And that has not always been the case, especially over the last 30 to 50 years. So there's been an infusion of money. There's been an infusion of anger and of militancy, where women say, we deserve more. And Hoag is responding to that. So we are looking at areas that we feel that we might have been deficient. And I think that we're creating an infantry, or maybe a militia of individuals that can care and provide caring for women of all ages and life stages.
Well, the future that you paint, I think, is already becoming part of a reality, as I see a lot of this in action. And you're an inspiration. You're an inspiration as a leader. And I can't wait to see where we build this together. And I know with what you're experiencing right now, it's not your favorite activity, but I think in many regards, it's going to save lots of lives, and it's going to make a difference with a lot of women that see your strength as you go through this, and will make a difference for their own care. So thank you for that.
Yeah. Well, thank you. Women can do hard things.
Yes.
And we do them together. So
yes. Thank you for your time today.
Thank you.
Appreciate it.